When we're doing speech and language testing, we often run into a problem. Standardized test scores don't always tell the whole story. A student may fall below the normal limits on the test, but that doesn't automatically mean that they qualify for services. On the flip side, a child may test within normal limits and still clearly struggles with communications in daily life. That's where using standardized tests for dynamic assessment comes in. The real power of standardized testing isn't in the numbers alone, but is how we use them as a springboard for deeper investigation. In this video, I'm going to show you 3 examples of how standardized testing can be used with dynamic assessment to get better results. Standardized tests, don't get me wrong, these are valuable tools, especially for reevaluations, but they're not perfect. They give us a snapshot of performance, not the full picture. But by pairing these tests with dynamic assessment tasks, we can validate results because they can help us confirm what the numbers really mean. Because when you put these 2 things together, there's a few things that happen. We can confirm or rule out areas of difficulty. We can see if a student can learn a skill with just a little bit of teaching. We can differentiate between language difference and language disorder. And we can write sharper, more specific goals. And here's the best part. Dynamic assessment does not have to be complicated. We're talking about creating tasks that take about 3 to 7 minutes. So let's look at this first example. In this one, dealing with receptive language and following directions, a child, Nina, she scored low on following directions. She got 9 out of 27 prompts correct. But after a quick teaching session, she scored 10 out of 10. The takeaway, her skills were still developing, not just disordered. And if we look at this, we see that the text that's in front of you is exactly the text that we use in the report. The numbers that we get from the standardized testing are valid. It gives us a percentage of accuracy by counting up the number of trials that they had versus what they got right. And then we can compare that to our second task by giving them a certain number of tasks and seeing how much they do correctly to see whether there's improvement or not. Let's look at a second example. This one deals with a child who had difficulty with the word structure portion of the self. So she produced some grammatically correct responses, getting 5 out of 17 correct. By looking at her errors, it was pretty clear that what she had been struggling with were irregular verbs. So we undertook a teaching session using something completely different but with very similar tasks. And in this case, Maggie's home language was Arabic. And when her father came in to help us repeat the task, it was clear that there was second language influence. And her word structure score, when those tasks were implemented, went up to almost near perfect. So initially she had difficulty with the dynamic assessment task. She was okay, showing that it was improvement. And lastly, let's look at an example from articulation. So a child, Ivan, he missed almost every S sound on the test. And probes at these sounds and syllables and placement and levels of support just showed that he absolutely couldn't get it. So the takeaway from this one is that a dynamic assessment probe at different levels using the sound S verified that yes, he indeed was having difficulty with the sound, and it made for good goals. It's better to think about standardized tests not as the whole story, but more like the beginning of the story. By weaving in dynamic assessment, you get more accurate evaluation results, avoid misidentification, and you can write goals that hit exactly what the child needs support in.